Welcome everyone to today's ILNet webinar. All right, we will give folks a moment to sign on. All right. Well, hi everyone. Welcome to today's ILNet webinar titled Addressing Care Deserts, Supporting Rural Transition with Self-Direction and Other Modes of Assistance. My name is Mary Kate Wells, and I use the pronouns she, her. For visual description, I'm a white 30-something-year-old woman with reddish hair and wearing a gray sweater. We're very excited to have you all join today. We have two phenomenal speakers, but first I'm just going to share a little bit information about the ILNet and some accessibility tips. NICL, National Council on Independent Living, is a partner with the ILNet Training and Technical Assistance Center, and we support the coordination of these webinars. And today I will be your moderator and help facilitate the Q&A at the end. Next, oh, perfect. So today's presentation is brought to you by the Administration of Community Living and the U.S. Department of Health and Human Services in conjunction with the ILNet. And the ILNet is operated by ILRU in collaboration with NICL, April, and the University of Montana. So next slide. Awesome. And on the slide 4 is the images of all the partners. A few accessibility notes for today. We do have captioning available. You can click show subtitles in your Zoom menu bar to turn them on. We also have captioning running on an external link, and the link has been provided in the chat. You can use that to adjust the view, size, font of captionings. ASL interpreters are also present today and should always be visible on the screen. Please let us know at any time if you cannot see the interpreters. The interpreters will also be available in the interpretation channel, which you can find in your Zoom menu at the bottom of your screen. We also have Spanish interpreters available today. You can also access that from the interpretation button at the bottom of your screen, and then select the language that you would like to hear the presentation in. And finally, we have public chat turned off, but you are able to chat the hosts and panelists. We ask that you reserve the chat for technical questions only, and submit any questions to our presenters in the Q&A box. We are welcome folks to submit questions in the Q&A box throughout the webinar, but we do ask that you, we will answer the questions at the end of the webinar. So I mentioned there's the Zoom Q&A box, but you can also email me your questions at mary-kate@nicl.org. And if that's more accessible to you, we will put that in the chat as well. And next slide. Can we go to slide 7? Or 6, we'll do 6, sorry. So today, just our learning objectives for today's webinar is we're defining what self-direction is and this term we're using, care deserts, and what that means. Identifying innovative strategies to leverage existing resources at SILS to support self-direction and other transition-related needs in rural communities. And then also to educate and inform sales staff on how to support consumers with accessing and using self-direction as part of their transition efforts. Next slide. As always, we love your feedback. So at the end of the webinar, we please ask that you complete our short evaluation feedback. This really informs what the topics we do and formats. So that would be great if you could take a few minutes at the end of the webinar. Next slide. And before handing it off to our awesome presenters, I just do want to put a plug for the ILNet or the Independent Living Philosophy and Practice Summit, Reclaiming Our Movement in September. This will be a 2-day summit learning intensive on September 17th and 18th. We can put the registration in the chat, but there's also a QR code on the screen right now. And if you have any questions, please feel free to email me. Next slide. So we have 2 awesome presenters. We're going to be starting with Erica Andres from a senior consultant at Applied Self-Direction. And then after hearing from Jennifer Kucera, healthcare outreach coordinator at the Center for Disability Empowerment. And she's also the chair of the Ohio Olmsted Task Force. So with that, I am going to hand it off to Erica. Thanks for joining today.
Thanks so much. Yeah, to tell you a little bit about myself, my name is Erica, like Mary Kate said. My pronouns are she, her. I'm a white woman in my 40-ish. We'll go with Mary Kate's description. I have shoulder-length brown hair with blonde and pink highlights, although the pink ones are very faded, so no judgments. I'm wearing a green dress with a pink sweater over the top with little flowers on it. At Applied Self-Direction, I work with case managers and participants in the self-direction programs. I work with case managers to ensure successful, unbiased case management and make sure that they're doing a great job for participants. And I also work with people in the program to ensure that they are getting the most out of their program and understand all the services available. I was also a self-direction case manager for about 8 years. And I have been a support broker in self-direction for about 3 years. But the bulk of my experience has been that I've been using self-direction to live in my own apartment for over 20 years. And that makes me feel kind of old to say that, but whatever. The bulk of my experience, I have a form of muscular dystrophy called spinal muscular atrophy. So I can't walk and I can barely really move my arms. So I need assistance at all times with all tasks. I have 24/7 staff in my home, and I manage an amazing team of 8 regular workers, 4 weekday workers, and 4 separate weekend workers. Plus, I have several backups on hand just because sometimes my workers need off or something like that because they are human and they do get sick or have a life outside of me, which I just can't imagine. Just kidding. But also don't worry if currently you're saying, that sounds really great for her, I think, but I really don't know what self-direction is. I have no idea what she's talking about because we're going to go through that in just a second and talk about what that is. So, but first we're going to start with what care deserts are, because that is something that is common in rural areas, and it's something that we're talking about today. So care deserts are areas where the supports needs of people are not met because there is little to no access to healthcare services, or there's low quality healthcare services. So care deserts are typically the result of lack of providers, whether it's direct service personnel, doctors, specialists, or other medical practitioners. Next slide, please. Other reasons for care deserts are lack of facilities or companies. For instance, lack of home health care companies or hospitals or medical offices, health clinics. Also, there can be long wait times or waiting lists. Before our current self-direction program, it was in Wisconsin, it was a 10-year waiting list for waiver services and self-directed services. People only could move up on the waiting list when someone passed away or when someone moved out of the state. They probably moved out of the state to move to a state without a waiting list, obviously. Other reasons for care deserts are the high demand and cost and or low supply or availability. We've all had that specialist that they're waiting to see. It took me over a year to see a neurologist, which is a specialist for muscular dystrophy. So they can take a long time. Next slide, please. And then some additional challenges for rural communities when helping with consumer transition is that there's little to no affordable or accessible public transportation. I'm from a super small town also, in a rural town. And just because my mom has no access to it, she calls Uber Uber because she doesn't even know what it is. She's never used it. She has no idea, but it makes me giggle. There's also that significant lack of affordable and accessible integrated housing, including year-long waiting lists for the housing choice vouchers. Although in some states like Wisconsin, for example, preference is given to people who are transitioning out of an institution. And also in rural areas, people and places are just really spread out. You might not see another house for miles. You might drive miles to a grocery store. In my town, the closest store was 25 miles away. So you really better hope you didn't forget an ingredient for dinner for that recipe because you weren't going back. I now live about 2 minutes from a grocery store. Next slide, please. And then some additional challenges for rural communities are just, I think we got to go back one more slide. There we go. Thank you so much. There's power outages or sometimes unplanned emergencies are more common because you're further from the power source, but also there's just other things that can happen. I'm not lying to you when I tell you when I was a kid, a deer ran into our electrical box at our house and knocked out the power for quite some time. So when I got up that morning, we didn't have any power. And I can tell you that my teenage self was mortified that I could not curl and wrap my bangs up before I went to school. Don't judge me. It was in the 80s. There's also a lack of providers with cultural competency or any cultural humility at all, because there's just less providers. There is a more likelihood that people who aren't culturally competent, there's more likelihood to have people with a disability bias or with ableism. I was the only person in my school that used a power wheelchair for mobility. I was the only person who had a physical disability. And when I entered high school, my principal saw that I had a physical disability and took me out of all of my classes and placed me into special ed classes because he thought I would be better off in one classroom than having to switch classes to go to my high school classes. I reminded him that I was in a power wheelchair, so it took less energy for me to walk around than it would take anyone to walk around. I just zoomed around. Also, many rural communities have diverse populations, such as Native Americans. So finding providers that understand or respect the varying cultures of individuals can be really difficult in rural communities. Next slide, please. Now, as promised, we're going to switch gears a little and give you that definition of self-direction I talked about. Self-direction is a model of service delivery where the consumer that's receiving the services has a high level of choice and control. The consumer decides when, how, and from whom their services are delivered. Self-direction is based on the independent living principle that people with disabilities know their own needs best and should lead the planning and managing of those services. Next slide, please. In self-direction, consumers are really empowered to hire, train, and fire their own staff, and also, in addition to that, manage a flexible budget to spend on what they need. Next slide, please. A few hallmarks of self-direction include a choice of goods and services to purchase, so there's no more cookie cutter, one size fits all, everyone gets the same service. It's really tailored to the person. There are many freedoms in self-direction, including the freedom to develop the workers' schedules and have people come and go as the participant in the program would like. There's also the innovative use of community members and resources. You're really reaching out into the community to find those caregivers. I currently have a third shift machine operator as one of my caregivers. She would never walk into a home care agency and say, hey, I think I want a part-time job. But because she saw my ad on Facebook and thought that'd be kind of cool, I could hang out with her. Self-direction also really honors the dignity of risk. Everything in life has risks. I mean, walking out your front door gives you risks, but self-direction really lets people take those risks for those rewards to be able to live a full life. Also, self-direction honors flexibility and creativity, being able to be creative and flexible about getting your needs met. So sometimes maybe, especially in rural areas, using devices instead of people when there aren't people available. Next slide, please. So to put things into perspective, I genuinely really like to talk about self-direction in real life and a real person. So we're going to go through a couple of examples of my experiences in traditional services versus self-directed services. So in agency services or traditional services, the agency sets the worker's schedule. As a college student, I had to go to bed by 9 or 10 p.m., even on the weekends. This was not a schedule that any college student wanted. There was no flexibility to stay up all night to study for that test that I maybe didn't study for, or do that last minute paper I'd been putting off. And there was no time to be able to go out with my friends. I was going to bed as they were going out, and I was getting up as they were getting in from a wild night of partying. Now I set my workers' schedules. I go to bed when I'm tired, and I get up when I want. Now I'm old and I go to bed by 9 or 10 anyway, so it really doesn't matter. Next slide. Other examples of traditional versus self-directed services is with traditional services, I ate meals on a schedule. Now I get to eat when I'm hungry. I had to leave a social event and be home and in bed before midnight because there's no care available after midnight. No care after midnight also meant that once I was in bed, I stayed in the exact same position until my caregiver came the next morning. Because of my spinal muscular atrophy, I'm not able to get out of bed, roll over or move myself, or even scratch my own head in the middle of the night. So I can't move without the assistance of another person. Really think about that. How many of you end up sideways in the bed when you wake up and you really have no idea how you got there? Unfortunately, I don't have that luxury. I also had to hope and pray that nothing happened and I didn't need to evacuate. I lived in a 10-story dorm at college that was primarily for freshmen and sophomores. The fire alarm went off at least once every weekend. Luckily, it was usually a false alarm, but I had no idea, and I just had to lay there praying that I wasn't going to burn up until someone came and told me otherwise. With self-directed services, I decide when I'm ready to leave a social gathering and get home because I also have 24/7 care, so I can have help whenever I need it, including in an emergency. Some final examples are, oh, sorry, can you switch the slide, please? In traditional services, I used the bathroom and showered on a schedule, and I wasn't even able to shower every day because of time constraints. Now I use the bathroom when I need to, and I shower every day unless I say otherwise. And finally, and maybe most important, in traditional services, I did not meet my caregivers until they showed up for their first shift. I had to train them on all that I needed to do in those first 2 hours, and then they would leave. I had 4 shifts a day, which meant 4 different people a day they had to train and learn. If I didn't mesh with someone, I could tell the agency and they could try to find someone else, but it wasn't always possible. Imagine having to rely on someone you don't like to provide you with really intimate cares like bathing and going to the bathroom. In self-direction, I recruit, interview, hire, and manage and train all of my workers. So I got people that I like and I want to spend time with. I also can have people that I love and already know on my payroll. My mom is on my payroll and she's mostly a backup. And I told her that I only put her on there so that I can tell her what to do and I can use the excuse because I said so. because it's a nice payback for when I was a kid. Next slide, please. Now we're going to transition to talking about self-direction and independent living and how they go together. So as you probably all know, by definition, consumer control with respect to the Center for Independent Living means that the Center for Independent Living, or CIL, so I don't have to say that every time, puts the power and authority in individuals with the disabilities' hands, including individuals who are or have received independent living services when it comes to management, staffing, decision-making, operating, and provision of services. Next slide, please. Then also, consumer control with respect to an individual means that the individual with a disability asserts control over their personal life choices and has control over their independent living plan, making informed choices about content, goals, and implementation. Next slide, please. So self-direction and consumer control. Self-direction is a really valuable service delivery model that gives individual consumers control of their services they receive for implementation of their independent living plan. So I really hope you can see how similar independent living centers and services are to self-direction. Just like self-direction helps people control who, what, where, when, and how services are delivered, so do CILs with consumer control as an organization and individual consumer. Next slide, please. So now let's talk a little bit about the history of Centers for Independent Living and self-direction to see why they go so well together. The reason they're so similar is because the history of self-direction is deeply rooted in the independent movement and philosophy. Early concepts of self-direction were developed and advanced by independent living leaders, including Ed Roberts and other disability activists, launching a self-direction attendant care program at the University of California at Berkeley. Next slide, please. Self-direction then became available to the broader disability community with the formation of the first CIL. Self-direction was often within and supported by CILs. As more CILs came into being and expanded across the country, so did self-direction. Next slide, please. Now on to what you all probably really want to know about why self-direction for CIL consumers in rural transition. Rural transition has many complex and unique layers. There are really so many parts that have to go right. Remember, self-direction gives an individual consumer more choice and control, and that choice is the choice of who will provide the services, what services will be utilized, when the services will be delivered, and how the services will be delivered. Next slide, please. So the answer to why self-direction is addresses individual needs when there are limited resources available, especially in rural areas. With self-direction, consumers specifies the tasks that are completed, so they can get help with exactly what is needed, not a checklist that some agency says should be done. Consumers can also choose a family member or a friend already providing the service, or someone that lives close by. That can be a concern in rural areas. Services can be delivered in different ways. Instead of having a transportation provider, if there isn't a transportation provider in that small town or in that rural area, maybe a friend can drive the consumer around. Or if there isn't a day program available to the person, or they just don't want to go to a day program, there can be a staff hired to provide one-on-one support during the day with the person. Next slide, please. Now that you have the basic info, let's connect the dots on how CILs can use self-direction to support rural transitions. CILs should have staff educated and trained on self-direction. Self-direction is so tied to CILs, and it can be helpful in transitioning that CILs staff should be experts on self-direction. They should know and understand what self-direction is, how self-direction works in their state. There are over 200 self-direction programs, and there are about 200 ways that things can be done in self-direction. So if you know one self-direction program, you probably know one self-direction program. So staff should also understand how to access Medicaid waiver services and how to get the services and use them. Also, how to leverage Medicaid waiver funding for home mods or etc. that might be needed for consumers to transition out of a nursing home into their home. Many programs allow for ramps or doorway widening or things like that could be covered, and those can be super helpful when transitioning. Next slide, please. So should designate and train their still staff as direction subject matters to assist with transition. And do you know who should be these subject matter experts? The people utilizing self-direction. They have the inside scoop. The people using the program are the experts and know how the programs run. So SILs really need to use that peer support. They also need to empower SIL staff to empower their consumers to use self-direction for transition or just have a full life in their own community. Self-direction can seem scary and daunting at times, but it truly is great resources and things, and something that I'm so happy I did. Now, I'm sure you all are probably kind of sick of hearing me talk, so I'm going to turn things over to Jen.
Thank you, Erica, so much. And welcome, everybody. I'm so glad you're here today. My name is Jennifer Kucera. I will give a brief description of myself. I was actually born with a disability, much like Erica said. I have the same disability, spinal muscular atrophy. Mine is actually type 2, if you know anything about spinal muscular atrophy. I started out younger. I had the ability to walk for a while, but it is slowly progressed to the point that I do use a pile wheelchair, and I'm really only able to control my left hand from the elbow down and control of my head, as you can see here. But I actually have been able to live by myself for the last, I think it's going on 11 years now. I did live in an institution for a couple of years and was able to use Money Follows the Person to get out of that institution and move into my own apartment. I live in the state of Ohio. I do have a managed care organization waiver called My Care Ohio. And I really love living in my own apartment, really under my own control, even though I don't use self-direction at the moment, because it was really not a good program in the state of Ohio. But we are working with our departments and agencies to make it a much better program, and I literally cannot wait until I'm able to use self-direction. So I'm currently using the agency model, but they actually treat me as if I am self-directed, because there would be no other way if I just had people coming and going that I did not know to care for me. So the people that I do know, I've had the same 2 caregivers. I've been very, very fortunate. The same 2 caregivers for the last 11 years. It's pretty amazing. I currently work at one of the centers in Columbus, Ohio, called the Center for Disability Empowerment. I am their healthcare outreach coordinator, and I also chair our statewide advocacy group called the Ohio Olmsted Task Force. So please feel free to Google anyone and look me up, or look me up on LinkedIn if you would like. I use the pronouns she, her, and I don't think I did my description. So I am a white woman in my mid-50s. I have my purple hair pulled up. I have a pink shirt on, and I have a blurred purplish background with, you can see some of certificates hanging on the wall behind me. And I use the pronoun she, her. Next slide. All right, so, yep, there we go. All right, so some of the things I'm going to be talking about today are actually just transitioning in general. As I mentioned earlier, I actually did use Money Follows the Person to get out of an institution, and I absolutely love that program, and I really wish that more SILs were able to do the work of transitioning, because if I had it, everybody that did not want to live in an institution was not living in an institution. So I'm a big proponent of transitioning and money follows the person. I also worked at a SIL, I don't know, probably about 15 years ago for several years where I did transition people out of nursing homes back into the community. And it was one of the best jobs I've ever had. It's just so exciting to get somebody out of an institution and back into the community again with the right supports. So again, some of the things I'm going to say today are just general things that a center should be doing in general when you transition people. But then some of them are going to apply directly to self-direction. So I'm going to kind of give you a mix with an emphasis on self-direction. One of the things, especially about living in a rural county, resources, as Erica mentioned, are tough. So you really have to get creative with your planning and your solutions. Thinking outside of the box is encouraged, really in any situation, but especially in rural situations. Things just, like I said, you have to get really creative and they may not be traditional models of solutions. But I know one thing, I know that I have been very creative in my solutions for living on my own in certain circumstances. The other thing, if you do work at a SIL or you do help people transition out of institutions, is you really have to get to know your consumer or your fellow peers with disabilities that you are assisting. A lot of this comes down to open-ended questions. It's not a check the box kind of survey that you can give to one, because as Erica mentioned, if you've seen one self-direction program, you've seen one self-direction program. So to be able to transition somebody, you really have to get to know your consumer. A lot of open-ended questions, because you may think of something that they have not, and vice versa. So drawing information out of them is very, very helpful. I also suggest that consumers and the peers have realistic expectations. You have to help them to develop a must-have list that they cannot live without. As an example, I was talking to a person with a disability and their family member, and they attended a college where they had everything available to them. The caregivers lived right next door in a room, so they could get up in the middle of the night and they could go to the local wherever, a movie, the bar, wherever they wanted to hang out because their caregivers lived right next door. Well, he wants to move out on his own. And I said, that may not be possible. So what things do you absolutely have to have? Another thing is that he has a Hoyer lift that hooks onto the ceiling. It's a track system. And I said, well, do you really need that? Or could a floor model? Because a lot of places and apartments won't accommodate the ceiling lifts for one reason or another. So you really have to develop a list of must-haves. What is necessary for a person's survival? And what are other things that they could live without? I know because of my situation, I do not have round-the-clock care. I only have X amount of hours. It's a split shift. So there's many hours in the afternoon that I am by myself. So for me, a compromise was to go without hot food. My caregivers help set the meals up in the morning. And by the time I usually get around eating them, they're pretty much room temperature. And that to me was a fine compromise. I don't mind that. I get to be alone here in the afternoon and I really value my alone time. So to me, I was fine with that decision. So there are things that you have to put on your wish list, but I always suggest just trying to have a must-haves list. And then also, community living is not right for everybody. There are people that don't mind living in an apartment. And like I said, I don't mind being by myself, but that may not be possible for all people. So making a pros and cons kind of document also is very helpful. And this is just in general, but it also pertains to self-direction, because going back to that must-haves list, like I said, I have an agency model, which is not always going to work for people. I would much rather have self-direction, which I'm going to go to. But what if you can't find anybody for a moment in the self-direction space? So then you might have to choose an alternative until you can train and have your own caregiver. So again, it's kind of developing that wish list with realism based on what is available. Next slide. All right, you have to lean into limited rural resources so that you can maximize transition outcomes. You want to help the person build a transition support team to be used as a resource. So this is another where I'm talking about open-ended questions. You want the person to feel completely supported before they get out of an institutional setting. And it's a combination, again, of utilizing self-direction and brainstorming really about their caregivers. Who do they know in their space? Who maybe do they not know, but they could know? Like, for example, once I'm able, right now, my caregiving agency, they drive me around as I'm not able to drive anymore. But once I'm able to use self-direction, I will advertise for a driver of the vehicle so that that person just has the ability to drive me from point A to point B, and that frees up the caregivers to do what they do with personal care. So, and I don't know that driver yet, so I would be finding them and advertising for that position. So it's brainstorming those kinds of things that the person may or may not need, but might be thinking about in the future as their situation changes. It's also about finding those caregivers and teaching the person how to train and find those caregivers. So the centers of independent living really have to be versatile in their knowledge that they know. So, even though the person that self-directs is responsible for finding and training their caregivers, not everybody is born knowing how to do that. I know I had to have peer support when I first did that, and even finding locations where it's advertised to get a caregiver. And that comes to thinking outside of the box. I have friends that go up to the local colleges and ask the teachers or the instructors if they can, talk to the students to maybe even, find a caregiver within the classroom setting. So you have to use all of those tools. Even responding, especially in rural areas, you really need to plan for health crises. And hopefully it won't happen to your consumer, but you have to be ready. And it's, from taking wheelchair chargers, having backup wheelchairs, perhaps, like, knowing where to go if you have to evacuate your house, and just that all out planning. You really want to build a really detailed transition plan and living plan for the person. Next slide. Thank you. Along with that, there's some basic knowledge that I feel throughout my experiences with Money Follows a Person and being a transition coordinator, is that the SIL staff should really have fundamental knowledge of how their state Medicaid and Medicaid waiver programs work, including the self-direction. I know a lot of times, like, I am an advocate through and through. I was a math teacher for a while, but I've always gone back to advocacy. It's in my blood. And so your SIL, if you work at a SIL, you really want to know the system in your state. Every state is different. You also want to know if you have managed care companies within your state that like in the My Care program for me is a managed care organization waiver. So you also want to get to know each of the managed care companies, how they operate, what they do and what they don't do, because every managed care company is different. Like I said, you want to know about your waiver programs. You want to know what's offered. You want to know about the self-direction program in your state, and get to know your state Medicaid folks and your aging folks. It's so important to build relationships with those organizations and agencies. You also have to know other things about the housing landscape that's in your area. I mean, that's one of the top things that is not available that we, hopefully we'll have more of one day, and that I know that we are advocating for in Ohio. but that's affordable, accessible, integrated housing. Know about all the options available. Make sure not only that you have a list of possible housing options for people, but that you know that housing. It's one thing to send somebody to an apartment complex and say, go check them out. But if you've actually visited that housing resource, then you know firsthand what it's like, and you can better suggest things to people or explain things to people, along with knowing what your public housing programs are and how they operate and what kind of dollars that they have. All of this is also advocacy work too, because not only do you need to know this, but you need to make sure that these things are included in their budgetary plans for the state. Next slide. All right, and this, again, this is the systems wide level. The, whoops, okay. Thank you. Along with the housing and the Medicaid programs, you want to know about the transportation options. And again, every area is different, what they offer. You have to be really, really knowledgeable about all the transportation options that are available, and also the rural, the public transportation pilots. There may be some things happening in your area, or maybe you can even develop one of your own and you can get some funding for it. But with self-direction comes even more than that, because people now, if there are Uber or Lyft services in your area that provide accessible transportation with using the goods and services under self-direction, it can increase the transportation options available for people. So you really need to know, again, of all those options that are available that people can tap into if they need to. And the same thing goes with internet technology. Is there workable internet in the areas that you're in? Where is the workable internet? Hopefully it is connected to the areas that have housing. Also assistive technology. I mean, we're getting into a world that everybody has some kind of smart home feature. Know how to tap into that, because under self-direction, we have the goods and services piece that can cover some of this assistive tech. A lot of it even is getting more and more of affordable, like the Ring doorbells. Things don't cost. They used to be all under durable medical equipment, so the costs were astronomical. Well, a lot of that is changing. I mean, I'm not going to say the smart speakers name because they will talk, but I can't live with one of those right now. It has saved me. There was a time I actually got stuck in a doorway of my house and I didn't have my cell phone with me, so I yelled its name and told it to make a phone call for me. And then they came right away and I was able to get out of the doorway. So things like that really increase the independence of people. And it's not as expensive as it once was. I have other devices. We can now get smart devices to open and close your shades and your curtain. So all of that could be covered under self-directed goods and services. And then, of course, we have the home modification portions under the waiver. But if your state doesn't have those, or even if you do, there could be other organizations that will provide assistive technology. So developing like a resource list of ways to get technology into a person's home is fabulous. And individual advocacy, I keep coming back to advocacy work, because along with knowing all these services, you have to advocate for more. It's the individuals, we all have to advocate for ourselves, disability or not, but we have to advocate for changes in our system. So if you see something that is lacking in your area and there may be something to do with that, reach out, talk to your legislators, talk to your representatives, go to other organizations that might be willing to partner with you or others to fix some of these gaps that we have in our service models. Next slide. So this is kind of what I was just talking about. You may now have a deep knowledge of your state's waiver system, but you want to even go beyond that. And I realize some of our centers are small and you do not have a lot of people power, but every little step is a step to closer services. And so if you know what your state looks like, try to research other states that might be similar. I just got back from the Home and Community-Based Services Conference, and I love that conference because it brings a bunch of states together, and I learned so much when I'm at that conference. But we have the internet, so if you have the internet access, you can learn about what other states are doing and take little pieces. Other states may not be similar to yours, but you could take little pieces, you could talk to each other, get ideas. It is just so important. And like I said, it's very, very important to stay engaged and actively involved with your state Medicaid and aging offices. I know in Ohio, we have developed partnerships with both our Office of Aging and Office of Medicaid, because who knows best? We know the best about the disability services. We are the users of the service. We are the disability experts. So we must be involved in the change and in teaching them how to best serve people with disabilities. Next slide. So the access rule. I'm sure that some of you out here have heard about the Medicaid access rule, but it is so important to, I know our state hasn't even switched over to the MAC, they're calling it the MAC in the back, the Medicaid Advisory Committee and the Beneficiary Advisory Committee. So obviously the Medicaid Advisory Committee are for those people that are involved in organizations, and the Beneficiary Advisory Committee is those that receive services. You may be able to be on both in your state if you work in an organization, but you also receive services. My state, even though I think the deadline is either passed or up and coming, they have not switched over to these yet. And so we are pushing our state to have the formation of these made, but make sure that you include yourself in at least one of these committees. And then also the MCOs in your state. Like I mentioned earlier, you want to get to know them. You want to get to know how they operate. Set up meetings, let them know who you are, let them know what you offer. A lot of times people they don't know what the SILs do. They don't know who we are. A lot of times the first question I get is, well, how many people do you house there? I'm like, we don't house anybody here. It's not an institution. It's a information giving system and help. We're the disability experts. So make sure you let people know that you exist. Work with the MCOs. If something is not working and you hear about a consumer that's having difficulty, help them advocate for calling the MCO. But you can also help out with that. Next slide. And this goes again to speak on systems change and getting to know your person. You've already gotten to know the person that wants to self-direct. You know what their needs and your wants are, but maybe something is not available. So this is where systems change, as I've been talking about, comes into play. You can start mobility advisory committees. Again, you know your list of possible transportation, but reach out because maybe there is funding for something to be started, or you know of an organization you can say, hey, what did you think about this? And increase the transportation that is in your area. Not only is it transportation advocacy, but it's built environment advocacy. There are other ways to get around the city. Those of us, I know I roll around in my wheelchair all the time. And there was this one time when there was not a curb cut in my area, and I live in a small town in Ohio, and the curb cut was not there. I reached out to my mayor's office, and within a couple months, they had put a curb cut in there. Now, again, that's an exception. I live in a small town. I was very thankful that they got that done so quickly. May not happen in your area, but be aware of these things when you go out. Rely on your consumers to tell you about these areas that might not be great. Curb cuts, ramps, I went to a restaurant in Baltimore and the restaurant still wasn't, I could not get in the restaurant. So things are like that are still happening. And if we don't shout out that awareness, it will never change. Same thing goes with housing advocacy. Look at your city plans. Look at your state plans for housing. You have to get involved in systems advocacy because a person can self-direct all they want, but if these things are not in place, they still can't get them no matter if that service is available. So we must all do systems change. Next slide. All right, these are a couple of ways that SILs actually could be involved directly with self-direction. And one of that is information and assistance services. So there's a lot of outside agencies that sometimes do information and assistance, and it's a service that could be added to a person's waiver plan. And this is the type of service that helps one self-direct. And they're also called support brokerage. You may have heard that phrase before. But this is where you would offer, and we're doing this anyway. We're doing this work, but we're not getting paid for it. So why not get paid for it? And again, that's the information and assistance service, a little bit different than information and referral, because this is where you actually talk with the consumer and do all of the things that Erica and I have said. You help a person find a caregiver, you help teach them how to train and interview their caregivers, and everything that we talked about that you should be doing or helping a person who is self-directing do. Asking those open-ended questions, helping them set up a plan. You actually could get paid for that if they added this information and assistance service to the plan. So some SILs across our country are already doing this. The other service that some SILs provide is the FMS, or the financial management service portion. So that's a little bit more complicated and you need to have a really defined plan for this. This is the financial management services. They're the ones that send out the paychecks. They take out the money, they help the self-directed consumer set up their budget. And so SILs can also do that. And we've seen some SILs do this portion of the self-directed piece as well. And I just want to ask my co-presenter, Erica, if there's anything that she would like to add that I may have missed about either one of these two services.
Hey, Jen. No, I think that you did a really great job explaining. Yep, the information and assistance is kind of the case management role is what it's usually referred to as, or a care coordinator. So you're the person who's kind of getting the person started in self-direction, helping figure out what services want to be self-directed, and then getting that budget set up and getting the services in place. And then really just assisting to make sure things go smoothly if you need your plan changed or you need, corrections made to it or additions or new services added, all of those things. It's really there to help you along your self-direction journey. And the financial management services, finances, right? They pay the bills and they send you, they send the participants in the program the monthly statements so you can make sure you're spending within your budget and you're staying on track. But otherwise, yeah, they're there just to help with all to get your employees set up and get you going. So thanks.
Yeah, thank you so much, Erica, for that in-depth overview. Thank you. Yeah, the setting up a budget part can be difficult for a lot of people. It's very, could be very complex, obviously, in self-direction. You can pay your caregivers different rates based on what you decide, the person that is directing, and you set up an agreement between you and the caregiver on the amount that, you know, everybody is happy with. And so the FMS kind of helps guide that along, like Erica said. And so SILs have done either one of those jobs across our country. I don't really have the data on which states do this, but if your SIL does not, they can always, you know, ask for more information on this and maybe become and offer one of these two services. Next slide. All right, so a few final important points. Everyone can self-direct with the right supports. I've heard from some case managers that say my consumer cannot self-direct, and this is completely false. With the right supports, everybody can self-direct. We have to be the advocates of understanding on this and telling others that they can self-direct and offer those supports to the person so that they can self-direct. Self-direction opens up a world of possibilities for people with disabilities. It is an amazing program, and if it is done right, I would fight to the death for self-direction if I could. And we need proponents that are working to make self-direction work for everyone. You want to keep an open mind and ask many open-ended questions when you're dealing with consumers and your peers that want to self-direct in supporting them with their transition. I mentioned many of them today, but it's those open-ended questions that are going to get the job done. And a lot of people don't want to take the time to do that anymore. They want an easy fix, a one size fits all. And it's not. Self-direction, as Erica said, and I said earlier, you've seen one self-direction program. Everyone is different. Everyone wants different things. So you have to ask those open-ended, time-consuming questions and bounce ideas. Your consumer will bounce ideas off of you. You'll bounce ideas off of your consumer. But together, with that support, everyone can self-direct. And remember that person-centered planning is not the same as self-direction. I'm going to say that again. Person-centered planning is not the same as self-direction. It plays a role in self-direction. At the beginning, Erica described and gave you a definition of person-centered planning. And, we want people that self-direct to have that person-centered planning because it is about the person. But it's not somebody dictating to them what that plan is. It's the opposite. They are dictating to everybody else what they want. They can pick from services, just like Erica said. She can now stay up till midnight, 1 o'clock in the morning, 2 o'clock in the morning. She was never able to do that before self-direction, but now she can because she's choosing to run her life like people with no disability gets to do. Should be the same for us with disabilities. We dictate our lives, not anybody else. So it takes person-centered planning like one step further. We are the deciders of our fate, no one else. Next slide. All right, so I already talked about that. And then one last thought. I know there's a lot of work across our country with charting the life course. And if you're not familiar with charting the life course, of course, you could do a Google search and bring it up. But I just want to give you some things to think about if you're considering using charting the life course as far as self-direction goes. You want to remember that this is person-centered, and charting the life course can be an all-encompassing model. And with self-direction, you're really looking for care. You're looking to control your own life. It should always, my feeling is that it should never be mandatory. It should always be, if you're going to use it, it should be a tool, but not mandatory for everybody to fill out. Because again, everybody's situation is different. And it also can be very overwhelming to individuals. In self-direction, I'm asking for care. I don't necessarily need an entire thought spelled out in front of me when using self-direction. And so just be careful. Think about using it if you are going to use it. And one other food for thought is that a lot of times self-direction can change. I'm going to say minute by minute. I know it won't change minute by minute, but we change, right? Every day we're a little bit different. And charting a life course, again, kind of puts out an even plan. It might get some helpful ideas in there, but it involves a lot of thinking and planning, and it can be overwhelming to consumers. So I just throw this in there so that you are mindful, if you are going to be using the charting a life course, that it may or may not work for everybody. So I will end with that. And I think we're going to go to a Q&A period, but I'll turn it back over to Mary Kate.
Awesome. Thank you so much, Erica and Jennifer. And you can stay on camera if that's okay, Jennifer, because I think some of the questions are going to be for you. Before we jump into questions, just a reminder, we'll be putting the evaluation survey in the chat. And then on the slide is also a link to the QR code to the IL Summit in September. I know when I was listening to both of you, I also went to the HCBS conference last week, and I was taking notes furiously because I'm always learning something new about self-direction and what that looks like in independent living. There's a few great questions in the chat that I'll read out loud, and if folks have other questions, please put them in the chat. The first question is for you, Jennifer. Catherine asked, the information assistance services, I may have missed it. Is that a fee for service that sales can perform? So I guess, yeah, if you could explain how, yeah, I don't know if you can just answer that.
Actually, I'm going to defer to Erica for that one, if that's okay, Mary Kate.
Yeah, definitely.
Information and assistance is generally built into a self-direction program. So it's generally something that a RFP or a request for proposals would go out when a new self-direction program starts or when a contract is being renewed. And it goes out to, depending on the program, statewide, countywide, wherever. And you can kind of bid to take that job. So you would look at the request for proposal and say, yes, I think we could do this. And then you would put in your application. The applications range. They're all usually like 3,000 pages, exaggerating a little bit, but they're quite long. But yeah, you can position yourself to be able to be a information and assistance provider just by filling out an RFP and filling out their application. And also I could come back on video, but it says I'm not allowed, just so you know.
I just sent a prompt. So oh, there we go. Okay. Yeah, so I think too, something might be helpful for folks. So when we say a new self-direction program, sometimes your state will call them waiver programs. So those are just some of the keywords you're listening out for, right? The language is gonna be a bit different in every state. So and I want to come back to that process, but at first I'll have Jen's question. Jen asks, if self-direction can work for everyone, would we still want to discuss the pros and cons of institutions? Obviously, the choice is on the consumer, but aren't institutions the opposite of the IL movement?
So I'll take that. And then Erica, please jump in. So when I said self-direction can work for everyone, it's self-direct. Everyone can self-direct, meaning you can't look at a person and say, well, you don't understand how the system works, so you can't self-direct. No, if you explain the self-direction program to them and how it works and break it down and help them kind of navigate it through step by step, everybody can understand self-direction and with the right support. So this may mean that somebody else also helps them with the interviewing their potential caregiver. But self-direction should not be forced on anyone. Pros and cons to discuss institutions, yes, if you're transitioning somebody out of an institution, it's not your job to decide if an institution is better for them or not. It's up to the consumer to choose that. Now, there are some situations that people want to live in institutions. I know of a gentleman that does not want to get out. He feels very secure. He feels safe, he feels secure, and he said that he doesn't want to leave the institution, even if he had all support in the world. And that's his right to make. So, to help a consumer think through this, I think is very important if you're trying to get them out. But at the end of the day, it's their decision what they want to do. And I don't know if institutions are necessarily the opposite of the independent living movement. Living movement is more about a person's right to decide and choose. So if they say that an institution is better for them and they've thought this through and they know the pros and cons, then it's their right to live where they want to live, whatever that looks like for them. Hope that helps a little bit. Erica, do you want to add in anything to that comment?
No, I think you answered it well. Just know that it should be anyone's choice when given all the supports that are available in self-direction and the extra help that can be added there. If the person still then doesn't choose it, that's not okay. That's okay. I'm sorry, that's not okay. That's okay. It just should be offered and the belief should be out there that anyone can do it with the right supports.
And I think too, another role the IL movement has in SILS is to advocate in the system level to make sure there are those resources outside of institutions, so there are options, right? So everyone has the right to choose, and the dignity of risk, and what you were talking about, Jennifer, about the peer support. SILS can provide that peer support. And we also do that advocacy piece of ensuring healthcare access and all of that, which I know is especially challenging in rural communities. So folks, please, if you have any more questions for Jennifer and Erica, please put them in the chat. I have a few, just when people are thinking. Erica, so during your part of the presentation, you're saying how SILS staff should be, kind of like subject matter experts in this process and system. I know this is one training resource, but would you have any other training resources or suggestions on how SILS staff can get that type of training?
Shameless plug for applied self-direction, right? The company I work for, we do have different levels of membership for people who would like to, and a lot of times, I am sorry, there is a fly in my house and it is flying on my face. But yeah, so we do have different levels of membership, and just today we planned our self-direction 101, it's called. So it's a very basic guide to self-direction and what self-direction is and how it can be. We also are currently working with SILS in a couple of states to set up self-direction programs and what self-direction can mean. So we also can be hired on for technical assistance to discuss programs and what it is and how you would need to get set up to be in a position to maybe do information and assistance or learn about self-direction. Just even as simple as setting up to do technical assistance with you to do a really intensive, what is self-direction? What does it mean? What does it mean for your SIL? Things like that. I also used to work at a SIL, so I'm very familiar with what the philosophies and things like that. So we could just definitely do a very intensive thing. But also, if you're a member, we have tons of member-only resources on our website of different things involving all self-direction.
Thank you. And it looks like we have another question in the chat from Elizabeth. Elizabeth asks, how do you navigate when a consumer wants to self-direct and make their own choices, but a family or parent, a parent or family member has power of attorney or guardianship and they want to stay institution based?
You want to go ahead, Erica?
You can go ahead and then I can add. And I can fight this.
Yeah, it's a very tough situation. I think if I'm not mistaken, you can also talk with your P&A system, protection and advocacy system within your state. Disability rights, like in Ohio, it's Disability Rights Ohio. So I would also talk with them to see what some of the options that they would even suggest. I know that's a very sticky situation and I don't want to say something that might be incorrect. So I would rather you talk with your disability rights organization in your state.
When I was a case manager in self-direction, I had a lot of situations where, right, it was the participant wanted one thing and the guardian or power of attorney or whoever wanted something. So first of all, remember that a power of attorney does not take rights away. It's just a person that's there to help. So if it's just a power of attorney, that can be easily switched. Well, not easily, but that can be changed. And the person based on the power of attorney does still have very many rights in their own life and livelihood. So if it's power of attorney, if it's a guardian, that's a separate story, obviously. But really also just maybe trying to do a lot of compromising or trying to figure out a common ground. So maybe you don't live in an institution anymore. Maybe it could be a transition to a group home or a adult family home or something like that to get into the community a little bit more. And then past that, maybe then you move into self-direction. So really just trying to find that common ground. Like, for example, I worked with a participant whose family was very into college and he needed to go to college and that was where he was going. And the gentleman wanted to stay home and play video games all day. And that's really all he cared about. So the father was the guardian and he said, "You're going to college. I don't care." So we found a program at the local community college that was literally video game writing. That's what he did for a living. So he went to college and he designed video games. So just like really trying to get that like common ground or that area where you can maybe make baby steps. But again, remembering that a power of attorney is very different than a guardian and those can change.
And I think too, that's where some of SIL's community outreach and education training of not only their partners, but community members on some of these different models or, supported decision making and self-direction, so that that is a more common kind of use versus like automatically say going to guardianship or something. So I could see that as another place where centers could provide support. And this actually kind of leads into what you were saying, Erica, about compromise and the advocacy. Catherine asked, do you find there is a need to build one's advocacy confidence before you introduce the idea of self-direction model? So looking at it as a setup, awareness, and education.
Guessing you'd like me to answer that one, John?
Yeah, I think.
Yeah, I don't know if I would see it as something that needs to be done before. I mean, I think all of us could build our advocacy skills. I mean, I've been doing this for a long time, but there's something I learned every single day. So I don't think it's something that could be done before. I think it could be built alongside. Self-directing would build somebody's advocacy confidence. So I almost think it could be done in parallel or side by side. So I don't think it needs to be done before. I definitely think again, the person might need a lot more hands-on assistance self-directing if they have never spoken up for themselves before. But I feel that it can still be done. It doesn't need to be one or the other or one before the other.
Right, then no one comes into self-direction knowing it, right? No one knows how, no, I happen to have a degree in human resources, but generally you don't come into self-direction knowing how to be a boss, how to recruit, hire, get your own workers. So you learn all that stuff. And by learning that, you're also learning advocacy, because I'm learning how to speak up for myself and have caregivers that do the things I want as opposed to doing what they want when they're here, right? And learning how to be a boss and how to be a good employer and how to have those difficult conversations, things like that. So you're learning them along the way. I think advocacy and self-direction are like go hand in hand, because you're learning how to be your own best advocate in a self-direction program, and you're also learning how to be in a self-direction program and being an employer. So
I'd like to add one more thing to that. I know that, I've been advocating for myself for so very long, but there are still things that I can't ask for. And my caregivers are like, you need to speak up. So even though I've been doing this a long time, because there were situations in my life where my opinion and needs were very repressed, I still have that trauma where I don't ask for myself. And I don't think like, oh, well, just like going to work. I had this job once where I did everything myself. And my coworker is like, Jen, why don't you get a caregiver to help you with some of this stuff? And I never even thought of that. So even somebody that's been advocating for themselves for so long doesn't think of all things. That's why we need each other to bounce ideas off of.
I think that's where some of the peer support really is key here too.
Mhm.
Awesome. We have two more questions, or one more question in the chat from Carol. And Carol, I just want to have you clarify, when you say PA, are you saying personal assistant services? I just want to make sure I'm going to say that. The question is, do you have any strategies for accessing I'm going to assume it's personal assistance services in rural communities where there's maybe limited people, agencies available to provide the personal assistance services? Okay, thank you.
That's the beauty of self-direction. You can hire anyone to be trained as your caregiver. I mean, anyone. I use the example of Bill down the street. Bill down the street has never even thought about being a caregiver, but he likes to come over and help me with my garden and outside type things. And so once I get connected with the self-direction program, I could hire Bill and he could help me provide gardening and other things. And so that's the beauty of it. It doesn't have to be somebody that would work in an agency or be a care provider. They just get along with you and you get along with them.
and really leaning into those skills. So I don't know. I am addicted to shopping. And so I've honestly found caregivers like, I love the Dollar Tree. I mean, who doesn't? It's a dollar. But I've like met people at the Dollar Tree, and I carry little business cards with me that say, want to have a fun job, and like literally hand a business card to someone. I don't pick up men at a bar. Apparently I pick up caregivers. I literally was a woman sitting next to me at the bar one day, and she asked me what my drink was, and we started chatting, and she started working for me for 8 years. So like, you don't have to, like Jen said, you don't have to go to an agency or things like that. You just live your life and find people and make up cute little business cards. Mine are pink and cute, obviously, because I love pink. And just make them fun and something that, where when you meet someone who's really cool, when you're at that restaurant and the waitress actually puts your drink in front of you instead of across the table where you can't reach it, maybe give them that business card and say, hey, I would really love for you to work with me. I know in small towns, there aren't a lot of places. Like I said, I grew up in a super small town. But even in small towns, maybe there's a library, maybe there's always a bar in a small town. We have 3 of them. So maybe you go in and you have that drink and you meet that neighbor that you just had a drink, so you're a little more loosened up so you can talk to them. But also just word of mouth, putting signs up. I've been known to sit outside pole dancing classes and a gym, because if you can hold yourself up on a pole, you can probably take care of me and lift me, right? So go to the local gym, things like that. But yeah, I mean, just really getting out into your community and living life and going to community events. I mean, I know that a lot of small towns have, like, my small town has local rummage sales, like our whole town does a local rummage sale. And I have been, I don't live there anymore, but I had been tempted when I was still living there to just put a booth up and say, hey, I'm not selling anything except myself and a job. So yeah, just really being creative with what you like, or if you like music, if there's a music store, put a flyer up there. If you like, I don't know, other interests, reading, put it up in the bookstore, things like that.
I love that. Thank you, Erica, for sharing some of those personal experiences too. It sounds like that community connection piece, you know, is really going to be key in some of those rural areas.
Also in rural areas, if you can't find people, there are, like I kind of mentioned in the presentation, there is also technology, right? There's like monitoring services and things like that. So if you can't have an actual human there 24/7 or however many hours you need it, you know, I've worked with participants who had a monitoring service overnight. So there were, you know, there was an alarm on his door. So if he went in and out, we knew. There were alarms on the windows. There was a thermometer, like temperature gauge. So if it went above, you know, if he actually put the heat at 89 degrees, which he did, it would automatically take it back down to a set temperature. So, you know, also just being creative and using technology to help with things too.
Yeah. And I think that's part two of understanding your state Medicaid and waiver systems on what you can use your waiver dollars for, and the goods and services piece, which allows folks to make some of those purchases. So I think that's a good resource to tap into as well. And I just see a comment in the box. Catherine, we welcome, as you said, I'm curious about building a training or awareness event to present statewide to consumers. So this has been a great training. Thank you. And there's never too many questions, Catherine. So I know we're coming up to around the end of time. But I did just want to give just a little bit space, if anyone has any other questions, or Erica or Jennifer, if you have any kind of final thoughts, no worries if not, but.
I think I mean, obviously I'm a huge proponent of self-direction, and I've been using it for a really long time, but I just think that sills are the perfect setup for self-direction and for people to know. As I said, I started out, my first big girl job was at ASL doing like hiring for the personal assistant services. And it's crazy to me how many people in our Wisconsin still don't understand what self-direction is and don't know what it is. But it's so rooted in this in the self-direction, in the self-philosophy, that it really should be something that's explored and just dove into, because as we've talked about quite a bit in this presentation, peer mentoring and peer support is the way to go. And the only way we're going to get that is with SILs getting involved, because the people who are using the programs, who are involved in the programs, are the ones with that inside scoop. And those are the people that you're getting the real knowledge from. You're getting the ways to make things happen. And so I just think that more SILs should really get involved in self-direction and know about it and encourage it and spread the word to other consumers.
Thank you. And, you know, we want to hear from you too on what other trainings would be helpful in this area. So if any feedback you have on like, hey, my center, I think we need this more specific training, or this was helpful, or this format, please let us know, because we want this conversation to continue, even though our webinar will be ending. Jennifer, any final thoughts? No worries if not, but I just want to leave some space. Nope. Okay, great. So awesome. And Ryan in the Q&A just says, thank you for sharing. So thank you everyone, Jennifer and Erica, for sharing this information today. I definitely think it's just the start of some more conversations that the community is going to have. And with that, I'll just, as a reminder, to fill out the evaluation form if you're able to, and check out our IL Philosophy and Practice Summit. And we hope to see you there. So thank you, everyone.